And we have at night, we have like probably two doctors that are like super, super chill. Like, you ain't nothing makes the job easier than when you can go to a doctor and able to communicate whatever's going on with the patient, and they're like, okay, well, we'll just adjust the exam because the patient's condition, or maybe just because of how the patient's being, or you know what, we'll just cancel it and we'll do this, or like it makes the job so much easier when you're able to communicate with the doctor, and they're able to understand what's going on, because there's other doctors you work with and you'll be like, sir, Mr. Doctor, sir, the patient in room 13 is not able to stand, is not in the best condition, and the patient is very hesitant to want us to do this 2-view standing chest x-ray that you ordered. Could we do a 1-view? And you'll say the most politest way, you state your case, and then certain doctors, if they're chill, they're like, yeah, cool, we can do a 1-view, it's fine. Or can you, I'll go and help you, or we'll get some extra help. We really need the 2-view, whatever. Da, 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 da. They'll give you like something, right? Other doctors will be like, what do you mean? Just do it. Get it done. That's what I ordered. Da, da, da. And they'll be like assholes about it. And you're like, well, I guess. Like, there's been times where we shot it and I've told them we're not going to get a good image because of this, because of that. And they're like, you do it anyway. And then you shoot it, you struggle, like a 2-minute exam becomes a 30-minute to 20-minute exam because of the patient and all the stuff going on from like start to finish. And then the doctor will be mad because the image comes out like not good, not optimal, or the patient's like making a big deal and causing a scene and stuff like that, and the doctor will get upset. And there's been times where even the nurses have been dragged into coming to help us, and then the nurses will be mad and like talking stuff to the doctor, and it will cause, like, one time it caused a big scene, and the whole time I was there in the middle of it, just thinking in my head, all this could have been avoided if we would have just shot a 1-view chest. We wouldn't have been dealing with none of this. 30 seconds in and out. Patient would have prevented the whole thing. But some doctors are committed to this is what they need, and there's no wiggle room. And I know certain surgeons are very particular on what they want. And the image has to be like textbook perfect, or their views, they'll whoop out a view that you probably never done, that you're just not used to it, and they'll ask for it. Or they want images in certain ways, or they want something very particular. I've noticed that with surgeons. And same thing with like post-op with spines and stuff, seeing it has to be completely lateral, even though some of these patients is not in the best condition, or they'll be like 98 years old and don't have no joints, or they'll be in pain, or whatever that's going on, and it's not the most optimal images. So you'll deal with a lot of different doctors. For the most part, at night has been pretty chill. Even some of the ICU doctors, I've noticed, we have a few here that are pretty chill. That like, you'll go up there, you shoot a chest, patient is like recently been like intubated or whatever they did, and you'll just shoot a chest, right? Certain doctors, you'll shoot it, maybe the patient's slightly rotated, maybe the patient's like you shoot it, and I would say most of the time we get a pretty good image, but then they'll start nitpicking. Like, the patient maybe will like be slightly rotated, like just a little hair, like nothing outside to the point that it would be concerning that it would cause a problem, but they'll make you reshoot it. They'll make you like readjust it, and they'll like cause problems. Even there's one time we had to shoot a patient like 4 or 5 different times, angling. Ended up having to wear lead to it, like hold the patient and do all this other scene just because the doctor wasn't happy with how like the patient's like how the image looked. And like the whole time we were looking at it, it was fine. Even another doctor was like, who ended up coming in, was looking at it. It's like, what are y'all doing? And which turned up to be the resident. The resident was causing all the deal, and the doctor, the real doctor, who was above the resident, came. It was like, why are you doing all this? Like the first image is fine. You don't have to do all this. Which I don't know what happened to that guy. So even residents, I've noticed, if you work with a bunch of residents, which essentially that's a student doctor, those will test your patient as X-ray techs because they'll order exams that some regular doctors wouldn't. There's been times where we've been called to the floor and the residents will order stuff and the doctor's like, what are you doing here, Miguel? And it's like, somebody ordered a chest X-ray. And then the real doctor will look at the resident like, why would you do that? There's no point of da da da, and then just goes on medical doctor stuff and then tells us to leave. And we're like, cool. You see how it wasn't necessary? Certain exams on certain patients that don't need to be done. Or some of them, they literally looked at, he's like, we just CAT scanned him. Why is he here to do an X-ray again on a chest? There would be no difference. And we're like, see? Learn from that man. But like, yeah, you deal with a bunch of people. Same thing with any other job. There's good, bad. And I mean, it all kind of depends. There's techs that, depending on how your personality is and how you take stuff, like we have certain, like our super chill doctor, right? If you didn't have a morbid sense of humor, you would probably think he's an asshole. Or if he has like a certain way he talks that seems kind of dry. And if you don't know, you think he's mad at you. Like, it all kind of depends on how you are. I'm super chill and laid back. Nothing really bothers me. Like, I get along with almost anyone. And so I could see how, depending on how your personality, certain doctors could irritate you or cause you not to have a good relationship. And once again, it all kind of depends on what these patients be doing that will give you a reaction between you and the doctor because of histories of certain patients that's caused issues. And sometimes it builds long-term relationships where you're like cool, chill, and other times it just slowly builds hatred towards certain doctors, or you don't want to work for certain doctors. But like at our hospital, we have a little schedule that lets us see who the emergency room doctors are. And there's always certain ones that, if they're working, don't even pick up, because you know for a fact it's gonna be a rough shift. So that's something that you guys can look forward to. So if you're still watching, I appreciate you. You can check out my channel, link below for some memes, and we'll see you in the next one.